Good afternoon, ladies and gentlemen. Thank you for joining me on yet another edifying edition of the program You're in Your Health aired on Equinoxe Radio Multimedia. According to UNICEF report, 67 million children worldwide missed one or more routine vaccines over the past 3 years. The UN agency says reasons for the decline include the COVID-19 pandemic, political instability, and conflict. The organization is calling for concerned action to increase vaccine uptake. On today's edition of the program, we'll be talking about poliomyelitis, a disease which can be prevented only through vaccination. And today I'll be receiving the director of the Bamenda Regional Hospital, Dr. Dennis Tame. Good afternoon to you, doctor. It is a pleasure having you on the program today.
Thank you very much, Immaculate, and a good afternoon to our listeners, and welcome to the Regional Hospital Bamenda on this program, You and Your Health.
It is a pleasure being with you. So, doctor, we'll go straight away since we have very limited time. What should a common man understand by the term poliomyelitis?
Yes, thank you very much. Really, the common man to understand what poliomyelitis is also called polio. It is actually an infectious viral disease caused by a virus that is transmitted not so through an oral route by ingestion of contaminated water or food, and this virus affects the nerves of the body, and it can lead to either partial or full paralysis. You know, when they talk about poliomyelitis, polio, there are two words. Polio stands for gray matter. Gray matter is a part of the spinal cord, and myelitis is inflammation of the spinal cord. So, when you have poliomyelitis, it starts with mild symptoms like fever, and then it can go right up to flaccid paralysis. But our community, our population should note that not all cases of polio manifest with paralysis. Only about 1 out of 200 cases of poliomyelitis may present with paralysis. Thank you.
You talked about one of the symptoms, which is fever. Is it only fever that is a major symptoms of poliomyelitis?
No, fever is just one. You know, flu-like symptoms. You will have chills, you will have pains, you can have some cough, you can have some, a running stomach, diarrhea, or nausea. So these symptoms, and which mimic other diseases. So that is it. Thank you.
Who is at risk of contracting polio?
Yes. Pardon the question, please.
Who is at risk of contracting poliomyelitis?
Yes. Everybody is at risk of contracting poliomyelitis. But the children less than 15 years are more at risk. Thank you.
Now, let's talk about the stages. At what stage do we say that the disease is already at an advanced stage?
Yeah, actually, we have some stages for the cause or for the evolution of the diseases. We have like these 4 main stages. You have like the pre-paralytic stage, and then that lasts for some 1 to 3 hours. You have the acute phase that can go from 3 to about 6 weeks of onset of the symptoms, and the convalescent stage that may take up to 3 months. And you have the recovery stage. You know, it's a viral disease. The recovery stage can even go up to 2 years. And you imagine that for somebody to go up to 2 years with the virus, this person at that time is contagious because the virus comes out in the feces, and if it's thrown in nature and somebody gets contaminated, you can have the disease. As I earlier said, you know, many persons can actually have the virus, but very few of them will present with really marked symptoms like paralysis. I told you just 1 out of about 200 cases of poliomyelitis.
You earlier said polio is contagious. What's the best way of preventing someone from being infected with polio?
Thank you very much. When we see about viral diseases, highly contagious diseases, we really think about prevention. And the number one activity in this prevention is vaccination. A person must have at least 4 doses of the vaccine to say that at least that person is been protected. And of course, they've been having campaigns. We have our routine expanded program on immunization, where we give polio 0 is given between the first and the 2 weeks of delivery. We have polio 1, which is given at 6 weeks of life, polio 2 given at 10 weeks of life, polio 3 given at 14 weeks. And the country has been organizing campaigns, and so many people have been taking also extra dose to reinforce their immunity, because transmission is actually an oral route. And we see that another way of prevention is proper hygiene and sanitation. Washing of hands before and after meals, washing of our hands after visiting the toilet, proper waste disposal, proper sewage disposal, so that people should not dump the feces in the environment. Because if you are infected and you can take up to this number of years to get the disease, and you are passing stool in the environment, this can contaminate the population around. Thank you.
So let's now talk about vaccines. How do I know I have been vaccinated, given that it was done at a very young age?
Really, it's interesting to know that you've been vaccinated. In our EPI services, the vaccination services, we give this card to the mothers or the parents who bring the children. The parents come when they have their polio 0 or their polio 1. It is actually documented in their card. And that is why you see when children are about going to their kindergarten, the nursery school, you find these schools will ask for their vaccination card to be sure that this person is actually protected, not only against polio, but against all the other more than 10 other diseases that protect them, so that the children in the school will not be at risk. So we have this vaccination card. We have vaccination registers in our various health facilities. And we also have, declaration from the parents, because when we are doing mass campaign, we don't give cards. We don't ask for cards. We just vaccinate the children either in schools, in the marketplaces, in the health facilities. We don't give cards. So the parents can actually testify that they have had at least more than 4 doses of their vaccination to be protected. But indeed, they can also do some lab investigations. That one we want to, collect the blood, get the serum, and it can be analyzed to test to see whether you have antibodies against poliomyelitis. This one is actually very costly. Thank you.
So are there any side effects of those polio vaccines?
Oh, side effects, very important. Generally, no side effects. You can have maybe a minor side effect, maybe 1 out of a million, and of very minor side effects. But however, if any side effects occur, we advise the population to go to the health facility and report. Thank you.
You are the director of the Bamenda Regional Hospital, and we know the Anglophone crisis has been ongoing for over 6 years. Given that, what are some of the measures you people have been taking to ensure that children get vaccinated, given that you are in a war-torn region? We saw in the introduction, UNICEF says about 6 to 7 million children worldwide miss out 1 or 2 doses of their vaccines due to COVID-19, conflicts and other things. What measures have been taken in that part of Cameroon?
Thank you very much, Madam Immaculate, for this wonderful question. We know the crisis in the Northwest and Southwest has made things not very easy for us to carry out our activities properly. But I will tell you that with all these challenges, a lot of trainings have been done already. The Regional Delegate of Public have organized a lot of trainings of the health personnel. How do we continue to give health to the population in times of crisis? That one, Dr. Samet did not learn it in school. The other colleagues and collaborators, all the 519 staffs in the Regional Hospital Bamenda, never actually learned this in school. That we are in it. And we have to be, our doors need to be open, 24/7. The measures that the Ministry of Health has actually taken is that we work with dialogue structures. Dialogue structures are community representatives who are doing a lot of voluntary work, benevolent work. They have no salary. We, the technicians, the doctors, the nurses, the lab technicians, we work with these community health workers, and when we have campaigns, we want to go out for vaccination. They know all the children in the community, in the villages. They will organize the children, and then we, the technicians, we come on arranged date, we do our vaccination, and we go back. So that is how we have been doing in this time of crisis. We depend a lot on community health workers. They have been working with us. And also the health personnel have been trained on humanitarian principles. We are actually there to help humanity, not so. Exactly. We are really impartial. We actually don't discriminate. We treat everybody. Everybody who has any problem should be treated. So we have been doing that, and of course, access to all the 20 health districts in the region. I think my regional delegate can attest to that. The health personnel in the Northwest region have been going around and carrying out their activities. Thank you.
We know fully well that there are some areas where these health workers can really carry out their activity. Let's say in those war-torn, very torn areas, like in the deep interiors. How do you cope to get to this level? Because we know the crisis has really affected a lot of people. They have even left these places. How then? Because there are some places that are very calm, but now where there's no relative calm, what is done there? Do you go with security elements, or how is it done?
Yes, actually, with us, the health personnel, we have really not been doing our work together with the officers.
Okay.
It's just that we have been working very much with the community and the administration. When we have any activity, we inform the administration we are going down for this activity. The delegate will give the communique to the administration. These are the activities. The campaign is going on. But going back to the community, not so. We have to negotiate access to the community. If there are some people living there and there's a community health worker in this setting, in this community where there is maybe some conflict, where there is maybe gunshots, he will communicate with the health personnel and say, now it is not appropriate for you people to come because there is shooting. So, you see, that is why we communicate and tell us, oh, there's some calm. We can come on this day because there's roadblock. Please don't come for vaccination. So it has been this community aspect in healthcare delivery, it's a wonderful tool to help us carry out those activities. That is how we have been surviving. And also when there are places that are too hot, we can do outreach activities in some settings. Can they bring the population in this safer area? Then we go and vaccinate the children, and then immediately we go back. Thank you.
I must really applaud that initiative, Doctor. So now, in 2020, the Minister of Public Health on his Twitter handle, Dr. Manauda Malachi, announced the good news that Cameroon was declared a polio-free zone. Is this still the case now?
It is. Thank you very much. That was the Twitter of Excellency, the Minister of Public Health. And actually, this message the Minister declared actually came from WHO Africa. You know, WHO Africa says there was no wild polio virus in 2020. That is what was declared. No wild polio virus. What do I mean by that? We have actually now seen that it's wild polio virus, and then there is circulating vaccination virus. That is the difference that the community should know. There is no more circulating wild polio virus. However, there could be importation from some other countries in the world. You know, people keep moving. We have countries like, Pakistan, Afghanistan, and I think Malawi too. There has been still some circulating wild polio virus. And so, since people move, it could be also transported. That is why we have not stopped vaccination. We have not stopped vaccination because not only the wild polio virus is not there, but we have some other virus that could be in the environment because of the vaccination. We know what is a vaccine? They give you attenuated polio virus orally, and then as that person stool, you know, some of the virus which is attenuated, has been weakened, can stay in the nature and becomes active again. But that virus is not a wild polio virus. That is the difference. So that is why we say our vaccination coverage is still not very much up to date. We still continue our routine vaccination to make sure that we are more than 90% at the routine vaccination. And we still organize regular polio campaigns, in the northern regions. I think campaigns are going on. And also, they have introduced injectable polio vaccine, and we've even migrated from just 1 to 2. That's not only giving the oral polio virus vaccine, we also give injectable vaccine that is given not so at 14 weeks of life and after 9 months of birth. Thank you, Immaculate.
Thank you so much, Dr. Dennis, for participating on today's edition of the program. And that's where we'll put a cap to today's edition. For our presentation, I'm Immaculate Fogwe, and I received technical assistance from Raphael Dipanda. Have a lovely day in the company of more interesting programs on Equinoxe Radio and, of course, television. So long.